May is National Skin Cancer Awareness Month, so this morning we've got Dr. Jochen here this morning from Contour Dermatology, who's going to tell us how to make sure our skin stays healthy. Good morning. Thank you for joining us.
Thank you for having me.
So tell us a little bit to start. There's a great acronym, kind of an acronym.
Sure. Yes.
Tell us what each of those letters, the A, B, C, D, E's that we have to know means.
Right. So when you're trying to determine whether a mole is a mole or whether it's a melanoma, what we do as dermatologists is we go through the A, B, C, D, E's. So A is asymmetry. So if you look at it, one side isn't like the other. B is border, and that means border is irregular. And a normal mole, it'll be round and smooth, whereas with a melanoma, it will be jagged and irregular, and the pigment may blanch into the surrounding tissue.
Oh.
So C is color, and multiple colors is bad, and black or dark moles are particularly bad.
Yeah, that's the big no-no.
That's the big no. Yeah. So if you see something really dark, get to a dermatologist. So D is diameter, which is greater than 6 millimeters, the size of a pencil eraser. And then finally, E is if you have a changing mole, you want to get that evaluated. So if it's bleeding or if it's growing or, the colors are changing, things like that.
Why do you think that skin cancer is often so overlooked?
I think because awareness, I think, is the most frequent cause. And I think denial is another cause.
Okay.
So I've had people who have had bleeding melanomas and they just never mentioned it because
wow.
I guess denial. That's the only thing I could come up with.
Wow, that's wild.
Yes.
Now, I know you've got a little tool with you.
I brought my dermoscope.
Okay, so tell us a little bit how this works.
Sure. This is a little magnifier, and what you do is you can see it's got a light on it, and so we'll just go for a mole over here, and we look and we say it looks pretty good, but I'm a little curious about it because it's a little bit bigger. So what I do is I just take my scope and I get really close, and then I can see it very magnified, and it helps us to evaluate that A, B, C, D, E under magnification.
Very good. So
it
that's
really
a part of what somebody would experience if they came in to get a checkup. How often should someone get checked up?
Well, I base it on if you have skin cancer, if you have a family history of skin cancer, or if you have multiple moles. So if you have any of those conditions, probably every 6 months.
Or anything that looks like that you can see there up on the screen.
Exactly. You can see there's an ulceration there. It doesn't look good. So, that's when you definitely want to come in and get checked.
What are some of the treatment options somebody could expect?
Well, the nice thing about skin cancer is they're on your skin for you to see. So if you catch them early, it's just a minor surgical procedure to get rid of it. If you wait too long, it can be more serious, and you might need chemotherapy. You might need lymph nodes removed, all kinds of things. So catch them early because the treatment's pretty easy.
So we're heading into the summer months, and this weekend we are expecting triple digits. What is the best sunscreen recommendation you can give, and what SPF should people be wearing? I always hear this question.
Yes. Well, that's a good question. I recommend SPF of 35 to 50, and you want to reapply it. And I like physical blockers, and those are titanium and zinc because those don't get degraded by the sun. They reflect light, and so to me, they're the best. Some of the big brand names are really good, like Neutrogena has a really good one. If you have any questions, you can always contact me on my website.
Of course. Well, thank you so much for joining us today. And of course, you always can contact Dr. Jochen at Contour Dermatology. And we'll be right back with some more news. Thank you so much.
Thank you.